Hello, Nick Majerison here, and welcome to Top Med Talk. On today's Top Med Talk, we're having a listen to a conversation that was recorded just after ACER 2017. It's about the POET acronym, a truly multidisciplinary Perioperative Enhancement Team, and it's explained by Professor Sol Aronson, a tenured professor at Duke University and Executive Vice Chairman in the Department of Anesthesiology. Have a listen.
Top Med Talk. Sol, how was ACER for you?
Well, it was, as always, a pleasure. I think one of the most nice things about going to that meeting, in addition to just seeing old friends and acquaintances, is it is, I think, one of the most rapidly growing societies in the States and international that truly is agnostic to any home base in the traditional sense of the word society. And I think that's really important. Medicine in the States, just like I would suspect in the world, is evolving to more and more of a team-based sport. And I think one of the excellent things about ACER is that it straddles that sort of traditional specialty definition in a way that a society meeting doesn't. And so it was, in short, a pleasure to be amongst friends.
Now, the ACER meeting is the ACER/EBPOM meeting because as part of the evolution of, there's a lot of enthusiasm for enhanced surgical recovery, which is fantastic at the moment. But the experience elsewhere in the world has been that what follows next is this greater embracing of perioperative medicine. Now, you've already been doing a lot of that at Duke under the guise of POET, which Paul Wishmeyer just referred to, or poetry. Can you tell us a little bit more about that? POET? Sure.
So, firstly, you must all understand and give deference to the fact that we're really into acronyms here at Duke. And there's going to be a whole alphabet soup of them that I'm going to be espousing in the next few minutes. But to begin, POET is an acronym that stands for the Perioperative Enhancement Team. I think in addition to it just being warm and fuzzy, it really embraces the importance of a team-based approach to all of these things that we all are, very sensitive to delivering on in the evolving world of healthcare. POET is multidisciplinary, and it bridges all the operations and tactics and finance and workflow planning and project management and IT integration and all those things that really are underscored as the foundation, the chassis of care redesign. And it brings all those competencies together to, evaluate the traditional ways that we've been doing things, to blow things up and redesign them in a way that makes more sense, but with a sensitivity to a risk-bearing healthcare world. And we integrate, obviously, finance and administrative factors and forces into that. And a consequence of those efforts, with all those smart people sitting in the room beating each other up to get a good product, is that we've come up with a number of optimization programs. Paul mentioned one of them in the space of nutrition, but in addition, we've focused on anemia, diabetes, pain, the elderly, and on as obvious areas where there's great need to address a otherwise modifiable risk of a patient before they have surgery, recognizing that many of those patients have those chronic comorbidities that are not optimized. And so the fundamental philosophy is that we believe everybody who needs surgery should have surgery, but they shouldn't have surgery until they're ready to have surgery.
And it sounds as though Duke as an organisation has embraced all of this, because there's often quite a tension depending on the different healthcare systems there as to how these things are monetised, how the pie's cut up, etc. But it seems as though your leadership there has really got behind this whole endeavour.
I think that's a really good point, and it shouldn't be understated. I think the things that we're describing that we're doing or proposing that we continue to do are not profound, and one could argue that we should have been doing that decades ago. But the fact is that the confluence of external, tensions that exist right now in the U.S. in terms of healthcare dynamic and change have really forced people to go back and reevaluate the way that they've been doing things. And so it's been interesting and very pleasant to sort of recognize that many of the surgeons, as well as administration folks, are embracing this. We're appreciating the need to skate where the puck is going, if you will, and things that are direct, like a revenue stream that we are fiscally responsible to recognize. Exist. There, even in a fee-for-service world, there are some contribution margins that can be had by just simply doing the right thing that we didn't necessarily do because we're so intent on driving a patient to surgery for reasons that sort of disregarded those other factors, as well as the I guess return from a contribution from a opportunity cost that we would mitigate by just simply doing the right thing and avoiding downstream adverse outcomes. Many of our surgeons are, frankly, in the States right now, very concerned about the report cards and their outcomes. And so things that are now more meaningful in a direct way are often motivating the behavior to have these sorts of programs be embraced and welcomed. So the appetite actually very positive for these programs.
Well, that's wonderful. Sol, thank you very much for talking to us today. We're running out of time at this end, but I'm looking forward to seeing you again soon, and we'll have a longer broadcast soon and go into greater detail about POET overall. Thank you, Sol, Dr. Aronson. Thank you, Mike Grocott. Top Med Talk.
And don't forget, you can meet the Top Med Talk team. All you need to do is turn up at one of our events. Check out ebpom.org for more details. ebpom.org. Our next big event is between the 28th and the 30th of September in Chicago. That's EBPOM USA, the Chicago Masters Course, Perioperative Care Practicum. Between the 28th and the 30th of September, ebpom.org for more details. That's ebpom.org.